Hello and welcome to the Evidence for Action webinar on the Research to Advance Racial and Indigenous Health Equity Call for Proposals that we released it last week. I'm Erin Hagan. I'm the Deputy Director for Evidence for Action. I'm also here today with our Director, Dr. Amani Nuru-Jeter, and our Program Officer at the Robert Wood Johnson Foundation, Dr. Claire Gibbons. We're really thrilled with the turnout for the webinar. I'm happy to have you all. So this is we'll be together today for about 90 minutes. So just to make sure everyone knows, this webinar is going for 90 minutes. That is to provide sufficient amount of time to answer questions from you all while we're together. So we're going to introduce the call. I want to note, and we'll continue to note throughout this conversation, that there are two types of awards being made through this call for proposals: the Rapid Response Research Grants and the New Research Support Grants. They have very different criteria across the board, and so it's just really important to be clear on which type of funding you might be applying for and the requirements for each, and we're going to try to get into detail about that today. Just a couple, I mentioned ample time for question and answer. And so just a couple of notes on housekeeping. You can submit your questions at any time during the webinar in the Q&A box of the platform. The chat has been disabled. There were a lot of people registered for this webinar, and so to help streamline our questions, we're just using the Q&A feature. Additionally, we are recording this webinar, and the recording of the webinar, the slides themselves, a transcript of the information shared today will all be made available on the Evidence for Action website. And we will email that information to all registered participants. Whether you were able to join in person or not, you will get that email with the link to all of those resources after the webinar. But again, it will be recorded and available for you after the fact. Without further ado, I'll turn it over to Claire to give us a little bit of intro into the foundation. Claire.
Thanks, Erin. Hi, everyone. Welcome. Thanks for joining us this Friday afternoon. Before I say, I'm Claire Gibbons. I'm the Senior Program Officer at RWJF who works with Evidence for Action. And before I say anything else, I just want to say thank you to all of the Evidence for Action staff. It was really a all hands on deck effort for their work on this CFP, and their work is really always excellent, but this CFP especially, I think, stretched all of us, especially when we're making changes at the last minute and doing the best we can to serve you all in the field, as things have been so changeable these last few months in our field. So thanks to you all, Erin and Amani and Steph and Natalie and Marissa and Janae and Lucinda and anyone else I'm forgetting, but thank you very much. So, I mean, what is there to say, right? Like, the last 100 days have been tumultuous for all of us. RWJF, as a private foundation, has the very luxurious position to be able to keep our resolve and our commitment to addressing structural barriers to health, explicitly naming racism and its manifestations as a key barrier to creating a future where health is no longer a privilege, but a right. And this CFP is one of the means through which we are working to achieve that future. So you're going to hear a lot about what we're looking for, but essentially we're doing a couple different things. As Erin said, we want to fund new and transformative research that's timely and actionable to advance racial and Indigenous health equity. And we also want to help to protect health equity scholars whose work has been paused or canceled from federal funding sources. And Erin is going to give you a really deep and well-grounded overview about what we're looking for. However, because we have so much interest in the field, because of the environment that we're in right now, I just want to offer two comments about this. And one, for the rapid response grants, our intent is to try to fund as many health equity researchers as we can. So you're going to see that we have a funding range available. We are going to be making decisions in part on how many people we can fund. So we really are asking you to think very carefully about the budgets that you're submitting and the number of people related to those budgets, and the communities that you can support in your work. So I really want to emphasize that, because that is going to be very, very important. And I wanted to highlight that for you all. And then secondly, for our new research, we're really looking to fund the most timely and urgent and actionable work. So there may be pieces of work that sort of are ongoing and are kind of always important. And at this time that we're in now, we're really thinking about how can we meet the moment? What is the work that really is most urgent and most critical to fund? So we want you to be really making the very best argument that you can to address that timeliness, the urgency, and the actionability, because those are some of the most important pieces of selection criteria that we're going to be emphasizing. So I wanted to draw your attention to those today, and you'll hear Erin kind of echo some of those emphases. But thanks again very much for joining. We're thrilled that you're here, and please do send us your questions through the chat and Q&A box, and I will turn it over to you now, Amani.
Great, thank you, Claire. And thank you to all of you for joining us today and for your interest in this funding opportunity. It goes without saying that it is especially important now more than ever to support research that advances racial and Indigenous health equity, and the scholars and practitioners that have dedicated their careers to this endeavor, or those who are building their careers to support this endeavor. E4A, as some of you probably already know, is explicitly focused on supporting action-oriented approaches focused on sustainable solutions to structural and systemic racism and colonialism as foundational contributors to health inequities. Under this call for proposals, we aim to sustain and protect the health equity research infrastructure and the people who do this critical work, which is, of course, all of you. We will discuss in greater depth later in the webinar, but this CFP really does reflect E4A's commitment to community knowledge and community leadership in health equity research. We believe that the knowledge, experience, and expertise of impacted communities is essential to a holistic understanding of the root causes of health inequities, not necessarily what they are, because we know what they are, but the ways in which they operate to uphold systems and structures that preserve health inequities. We also believe that that same knowledge, experience, and expertise is essential to identifying and developing solutions to advance racial and Indigenous health equity. Accordingly, the CFP highlights the value we place on community partnership and community leadership, power sharing, having a solutions orientation, actionability, as Claire just mentioned, this kind of focus on asset or strengths-based work. So recognizing the assets and strengths that already exist within communities. And then additionally, anti-racist and anti-colonial research approaches and practices. I also want to mention that this CFP and our review process has been heavily informed by our previous Indigenous-led solutions call for proposals that we released last year, as well as the Ways of Knowing Symposia series we co-hosted last year, both of which were focused on uplifting community knowledge and recognizing the myriad ways in which knowledge is created. For those interested, you can learn more about either of those efforts on our website. And I just want to say that we are so grateful to everyone who contributed their knowledge, insights, and time to making those endeavors successful, and those that continue to support E4A. So our learnings as an organization over the years, including from those partnerships and from our prior grantees, has really helped us evolve as an organization to get us to the point where our sole focus is to support work that disrupts structural and systemic racism and colonialism and its adverse health effects, which by design are unevenly distributed within and across populations. With that, I want to acknowledge those who worked, as Claire mentioned, diligently to craft this call for proposals. We have such an incredible and committed team of individuals without whom none of this would be possible. So as Claire said, moving on, things have been rough, to say the least. We are attempting to meet this moment through two approaches: rapid response research grants and new research support. Rapid response research grants are intended to at least partially offset interruptions to federally funded racial and Indigenous health equity research projects. And new research support will fund new, timely, and actionable research to address ongoing threats to racial and Indigenous health equity. Through both mechanisms, we seek to build an actionable body of evidence for constructing just systems that advance racial and Indigenous health equity. A total of $5 million will be awarded through this CFP, approximately $2 million to rapid response research grants and $3 million to new research support grants. Each award type, as Erin mentioned, has distinct application and review timelines, eligibility and selection criteria, and funding priorities. And again, we'll go over all of this in more detail shortly. You are allowed to apply for both types of funding, provided you meet all of the criteria. However, as Claire mentioned, funding is limited and needs are high. It is not our intent that applicants use both funding types to piece together a larger total amount of funding. Instead, we intend for the two approaches to serve different purposes and to support different types of research. While we wish we could do more, our goal is really to support as many scholars, practitioners, and projects as possible. I should also note that the specified grant budgets are caps, not fixed amounts. And so we ask that you be discerning in your funding requests. Again, our goal is to fund a large and diverse portfolio of grantees versus just a few grants at the maximum budget amounts. With that, I'm going to turn it back over to Erin to get into the detail of each type of funding.
So moving on to the new research support grants. So we anticipate awarding about 3 million of the 5 million that we have for this call to new research support. These grants have larger caps, up to $500,000. However, having said that, we want to also award some what we would consider smaller awards through this mechanism. And so we anticipate awarding at least 4 projects of up to $250,000 and at least 4 projects of up to $500,000. I think our preference would be to award grants in a wide range in between all of those. Amounts, but no, this is really to indicate to you that we do expect to award some smaller grants as well, not all $500,000 awards. These grants can also be longer in duration, up to 36 months. And so again, amounts are inclusive of indirect costs and across the entirety of the grant duration. So it's 500,000 over 36 months, not 500,000 per year each year. This is a 2-step application process. Letters of intent, anyone can submit a letter of intent, but full proposals will be invited. So only those who are invited to submit full proposals will move on to the next stage. Letters of intent for new research support are due July 16th. You will then be notified the week of August 25th whether you are invited to submit a full proposal. You'll be notified either way. And then full proposals are due December 17th, and we will make funding notifications the week of February 16th. We expect grants to begin April 15th of 2026. We recognize that's almost a year away, but as Amani mentioned, one of the things that we learned during our Indigenous-led solutions call for proposals and during our Ways of Knowing symposia are that for many, especially Native communities and community-based organizations, a longer submission timeline is really necessary. And so one of the hallmarks of this track is that the lead applicants must be a community-based organization. And CBOs are inclusive of, it's sort of a broad definition that basically means not a university or academic institution, or institute of higher education, or a contract research organization. So otherwise a pretty wide range of what constitutes a community based organization. However, we really are hoping that we will see partnerships still with universities or with academic researchers. It's just that the community-based organization must be the lead, and academic organizations can serve as contractors, subcontractors on those projects. If as a community-based organization, you do not have the administrative capacity to receive and allocate the funds, you may use a fiscal sponsor. Again, these awards are focused to US organizations. However, if you have international partners, you may subcontract internationally, but we would expect the research itself to be focused in the United States. There are 7 eligibility or selection criteria that we are judging grants on at this stage. And I want to note that we are reviewers are applying these criteria at both the letter of intent and the full proposal stage. It's just that, of course, at the letter of intent stage, which is only a 2-page narrative, we expect a little bit less information, and at the full proposal stage, we would expect to see significant detail about all of these criteria. Still at the letter of intent stage, we're looking for as much detail as you can give us about this information. And so please do, it's a 2-page narrative that you will upload. Please write in a narrative format as much detail as possible. The letter of intent in the application system has a template. I could not underscore enough the recommendation to follow that template. We put a lot of thought into developing them. It lists the information that we need to evaluate your proposal. And if you include information that we don't ask for, you're shortchanging yourself on the space for the information we do need. So again, we're looking for relevance and significance to advancing racial or Indigenous health equity. And we're looking for actionability. These are probably the 2 top criteria we're going to initially be looking at. You should be able to, in terms of actionability, you should be able to explain how the research findings will ensure tangible benefits for communities to advance some solution to racial and for improving racial and Indigenous health equity. Then we're looking at the methodological appropriateness of your research design. We want as much information about your design as possible. I want to highlight the methodological appropriateness piece. This means that your methods should flow logically from your research questions. We do not have a hierarchy of methods that are sort of like the gold standard generically, absent the question. We fund a variety of different types of research approaches and methods. The important part is that the methods are aligned with the research overarching aims and the questions that are being posed. And these methods should also be culturally appropriate and reliable. And when we talk about methodological appropriateness and how you articulate this, you should be able to clearly specify research questions, describe the approach, a theoretical framework that is guiding your work, how you will measure any outcomes you're interested in, the data collection and analysis plan. Again, please provide as much information about those those characteristics as possible. We also are concerned with the process and of the research that we're funding. So it's very important to us that we are supporting equitable research practices. This means that it's not that equity is baked into not just the questions you're asking, but the manner in which you're engaging in the research. And so to reiterate some of Amani's points from earlier, this means power sharing, shared leadership, and language and framing that is situated around the strengths and assets of the people who stand to be benefited by the research. You need to demonstrate a clear and compelling connection between your research and health. The Robert Wood Johnson Foundation is an exclusively health funder, and so it's important that you demonstrate that connection. If you are studying the impact of a solution on health, then you should have health relevant outcomes. We do consider health to be a broad concept, both health and well-being, that are inclusive of physical, mental, social and emotional health and well-being, but you should demonstrate that the work that you're doing is directly connected to health in some way. We also are looking that the characteristics are in place to be able to carry out the research that you are proposing, and that the study is designed in a way to answer the questions that you are posing. And then finally, we're looking at the project team expertise. And so you should be able to demonstrate that the appropriate and necessary skills, backgrounds, and expertise are reflected in your team. And this means not just academic expertise, and methodological expertise, but also relevant cultural, contextual, and practical expertise. And we expect to see the perspectives of people who are directly experiencing the situation that you're interested in through your research reflected in the project leadership and decision-making throughout all phases of the research process. Just to sort of double down on this point, a community advisory board is sort of not sufficient for reflecting community priorities and leadership in the studies that we're looking to fund. So again, this is sort of reiterative of what is a good fit for the Evidence for Action program. We are looking for projects that can drive transformative change. That definitely means you're not describing the problem in greater detail. It means that you're building upon an existing body of evidence, whether that be empirical or experiential, or anecdotal. And then we're focused on upstream systems level solutions, so not individual level interventions like cultural competency or implicit bias trainings. We do not fund curriculum development. These should really be larger scale systems level changes, not asking individuals to change within a biased or oppressive system. And then we are similar to what I mentioned under the rapid response grants, looking for a track record of commitment to racial and Indigenous health justice, conducting research in service of and in partnership with Native peoples and communities of color, applying the equitable research practices, and ensuring your findings are actionable. And you can demonstrate that by having clearly engaged with both community members and decision makers before you're submitting your application, and having your study be informed by their perspectives. So to touch on the submission process, as I mentioned, the initial submission process is a 2-page letter of intent that must be submitted before 3 p.m. Eastern Daylight Time on July 16th, 2025. Again, similar to the rapid response research, you must submit your application materials through the application and review system. And there will be a series of project information questions, the letter of intent narrative, the 2-page narrative, and just a few other related materials. Predominantly at the letter of intent stage, we're accepting CVs or resumes. And then there's a couple of other sections about your organization that you would need to complete. The specific project information questions that you will be responding to are to talk about the impact of the funds, why and how they will be particularly relevant and impactful in the current socio-political context, to talk about how your research, this specific research that you're involved in, will help advance racial or Indigenous health equity. You need to describe how people who can make decisions about the solution you're interested in and who are most impacted by those decisions have been involved already in developing the project, and how they will continue to be involved throughout the lifespan of the research. And then we're asking for a positionality statement that highlights really the identities and experiences of the core team members in relation to the project. So this is where you would talk about the expertise and experiences that your team brings to bear collectively. In the letter of intent stage, you will submit an actual narrative. You'll upload a 2-page narrative. Again, I want to reiterate, there is a template. Please follow the template. And you will speak in the template to the selection criteria that I briefly went over just a few moments ago. A couple of things to not include at the letter of intent stage. You do not need to include citations at the letter of intent stage. We do ask for them at the full proposal stage, but please don't include them at the letter of intent stage. Additionally, you should not include a breakdown of your budget at the letter of intent stage. You only need to provide a specific budget request, again, inclusive of indirect costs. That budget request could be modified at the full proposal stage if needed, but there is one line for you to provide what your budget request is at the letter of intent stage, and that's all that you would need to provide at this stage. At the full proposal stage, I'm only going to touch very briefly on this. If you are invited to a full proposal, you will get significantly more detail and guidance around that submission process. But I do just want to let you know that at the full proposal stage, there's a 10-page full proposal narrative. You will submit a more detailed budget and budget narrative. This is not the same budget that I described for the rapid response research grants. This is a much more detailed budget as well as a full narrative. We also requested dissemination strategy. So it's important to know that for new research, our funding is inclusive of dissemination, and we would expect for you to be disseminating your research prior to the end of your grant period. So you should both budget time and money to disseminate your findings after you've completed the research. Similarly, you will submit a timeline at this stage, at the full proposal stage, along with resumes, CVs, etc. And note that at the letter of intent stage, we only are accepting 2 CVs or resumes, but at the full proposal stage, there is space to submit additional CVs. At the full proposal stage, you'll also be asked for letters of support, and as well as copies of any measurements, instruments, interview guides, focus group protocols, etc., that you might be using in your research. All right. Now I want to turn back to the questions. I just do want to mention we're going to take a few questions now. Then we are going to cover a little bit more information about our review process. And then we'll open it up for an even more extensive Q&A period. So maybe we'll take about 5 minutes of questions here, go over the review process, and then we will get into questions on any topics. I am gonna just switch the questions to most recent so I can prioritize projects that came from new research support. Just screening through lots of rapid response questions, and I want to try to prioritize those that are about new research support for the time being, and then I can come back to rapid response research. So there is a question about who your research might be focused on. I think this probably was submitted in the context of the rapid response research, but I'm going to go ahead and field the question now related to this the full CFP. So the question was, if your research is focused on Asian subgroups, do you qualify, and why leave them out and not include them? So first of all, yes, your research could have been focused on any marginalized, oppressed community of color or native tribal group or indigenous community. And folks who have been doing health equity research would be familiar with the ways in which you might be thinking about how your research was I am in the interest of time, and so just to reiterate, the research itself, and especially for rapid response research grants, we really are looking for community-based organization leads. We don't have the same kind of criteria or preferences for the project directors at that particular level. And I'm in the interest of time, and because there is an overabundance of questions about rapid response, I'm going to go ahead and have us speak a little bit about the review process, and then I'll just open it up to questions more generally.
Hey,
Um,
Erin.
great.
Sorry, there were a lot of questions about what qualifies as a community-based organization. So did you want to talk a little bit about what we're thinking of, what we mean by that?
Sure. Yeah,
Yeah.
thank you for that. My sorting feature was not working as well on my questions, but so community-based organizations, from a purely legal tax perspective, could include nonprofits, for-profits, government entities, non-governmental organizations, et cetera. We do have a preference for nonprofit designations, but we are able to make awards to for-profit entities. Ultimately, we're looking for community, I'm going to reuse the term, but community-based organizations that are based outside of academic institutions. This is driven by our value in shared partnership and leadership. Our experience is that research grants have overwhelmingly gone to academic institutions and contract research organizations who are then expected to subcontract out to community-based groups. And we have heard that that is often a bumpy process, and that those partnerships don't end up playing out in some cases as well as we would hope they would. And so to help sort of swing that power dynamic, we are prioritizing community-based organization leads. We do hope that ultimately through our work and through the Robert Wood Johnson's Foundation's work to transform the health science knowledge system, that we will eventually get to a place where it wouldn't matter which organization was the lead, that funds were always distributed equitably, power was equitably shared, and true and meaningful partnerships were exemplified regardless of the lead organization. But at this point, we are focused on organizations outside of academic institutions to serve as the lead, again, reiterating that academic institutions may serve as subcontractors in those awards. Amani, anything else you want to say about our focus on community-based organizations before we move on?
No, no, I think you said it all. I think the spirit of it really is that we're trying to flip the typical dynamic on its head to honor our positionality of the importance of community voice, community expertise, community knowledge, where community-based organizations and communities that are typically subcontractors typically get the short end of the stick. And so we're really trying to support not only community engaged, but community-led research. So that's the spirit behind the CBO being the lead institution or organization.
Thanks so much. So in the interest of time, I'm going to move on just briefly to our the application review process to shed a little light for folks. Applications will be reviewed by the leadership of the Evidence for Action National Program Office, Robert Wood Johnson Foundation program officers and leadership, as well as an interdisciplinary group of racial and Indigenous health equity scholars, advocates, community organizations, community organizers. And our reviewers are profiled on our website. For the new research support, the reviewers that you can see on the website are probably representative of the full group of folks who might be reviewing your application. For rapid response grants, we're expecting, again, an overwhelming rate of submission. And so we likely will pull in other folks to that review process, but they would still meet these criteria of being racial and Indigenous health equity scholars, advocates, community organizers, and doing this work, having a track record of doing this work. The process is that applications are screened, and then assigned to a subset of reviewers to review based on the selection criteria. And that we will weight applications based on the selection criteria and preferences outlined in the call for proposals. Ultimately, final funding decisions are approved by leadership within the Robert Wood Johnson Foundation's Research, Evaluation, and Learning unit. So that pretty much covers the review process. So I just wanted to get through anything that we had remaining. I will note that you will be notified of the status of your application, and we will but you will not be notified until the deadline. So even if you're submitting early, and we do encourage you to submit early, we may be screening early, but you will not receive a notification until the deadline, until the specified notification date. So at this point, I am going to turn back to the wide range of questions that we've been receiving, and I've sorted them by upvoted, so I'm going to work through them by upvote. If other people want to upvote other questions, now would be a good opportunity to get your question answered. We have about 15 more minutes to take questions, and then just to reiterate, we will be hosting office hours. The first one is scheduled for next Wednesday, the 7th of May. And so those are just drop in, although you do need to register in advance so that you can have access to the link. So there's a question about what is a fiscal sponsor, and could a community-based organization be the lead applicant, but the university submit the LOI and manage the funding. So universities are technically allowed to serve as a fiscal sponsor, although it is not our preference. A fiscal sponsor means a specific thing in terms of there are organizations that are set up as true fiscal sponsors, which means that while they hold the money, they receive it and they disperse it. They do not have independent decision-making power about how that money gets dispersed. Based on my own knowledge of universities, they're not well suited to serve as fiscal sponsors, but if you can demonstrate that the university meets the criteria that are required of fiscal sponsors, then yes, they could serve in that role. Having said that, they cannot be the lead organization. Fiscal sponsors, the designation of a fiscal sponsor lead comes in only at the full proposal stage. So at the letter of intent stage, the community-based organization would need to be the lead. And again, when there's a fiscal sponsor, there is still documentation necessary about who the true lead of the application is, with the fiscal sponsor serving as, again, just serving fiduciary responsibilities. Some of these questions have been answered, so I am going to just keep going. Yes, there's a question about whether we consider tribal governments or Indigenous or Native community, what in our Indigenous-led solutions we called Indigenous serving organizations are considered community-based organizations. Yes, so tribal governments and other Indigenous serving organizations may serve as lead applicants. And I just want to take a moment to mention that, again, we are not the federal government, and so we have no requirement around whether the federal government has recognized a tribal group in order to be eligible to apply for our funding. So while we certainly invite federally recognized tribes to apply, non-federally recognized tribes and other Indigenous groups who are not, who don't have sovereignty recognition by the federal government, such as Native Hawaiians, are also eligible to apply under both tracks. Oh, this is a great question. And Amani, I'm going to ask you to speak to it as well, and Claire, if you would like to. So the question is, how do we define research for this grant? For example, can it be secondary data evaluation as opposed to primary data collection? And one issue that CBOs may face is navigating IRB processes. And so it would be helpful to know what we expect from a research approach. And I'll just briefly say that Certainly, secondary data collection and analysis is allowed. We don't have specifications around, again, the methods or analyses or approaches for the research that we fund. But I think the general question about how would we define research is a good one, especially in this context. And Amani, if you want to speak a little bit more to that, and then Claire, you might as well.
I mean, I would just say that, you know, we don't distinguish between, as Aaron said, primary and secondary data collection. I think the goal around research and the way research is typically defined is around dissemination. So what are your goals with the work? And that's usually what is required to go through an IRB process, is that it's not for organizational improvement, but it actually is to answer a question that is intended to generate knowledge that will be disseminated more broadly than just kind of held from the perspective of organizational development or improvement, if that makes sense. Typically, when your work is intended to be disseminated, then you do have to go through an IRB process. And the IRB is the one that determines whether or not it's going to be exempt, expedited, or full review. So I think if your organization, I think, you know, you could probably come to office hours to talk more specifically about particular cases around how you get through an institutional review board kind of process if your organization doesn't have one. But anyone can be engaged in research. And again, the kind of key distinction is around dissemination. And remember that this CFP is really around action-oriented health equity research. So we do have very explicit review criteria around, especially for the new research component, especially around kind of actionability and this idea of the work being able to inform short-term actionability in one way or another, and you're able to actually articulate a dissemination plan and an action plan to move that research forward. So I hope that answered your question, but Claire, you might have more to add on that.
Yeah, I agree with what y'all have said. Thanks, Imani. I think with respect to this question about a literature review, so I don't think the question is like, what is research? It's what are we looking for? And so make sure you go back and look at the call for proposals. We tried to be really clear. We have a long history of funding through Evidence for Action. We've been pretty consistent. I think what the majority of the work that we funded has been experimental or quasi-experimental studies that usually have a control group. And a lot of times are looking at some sort of program or policy and whether it has the intended impacts or not. So that's most commonly what we've done. We also sometimes do fund work related to measurement. It varies. I would say ultimately what we're looking for is something that's actionable. So as Imani said, like, is this going to be something that can lead to an action by somebody in a community or a decision maker that is going to then result in improved health for people and health equity? So that's, I think, really what we're looking for. So a literature review, I do think that falls under, that's research. But for us, a project that's a literature review only, that is not going to be very competitive for this opportunity.
And Claire, thank you. I want to just add one clarifying point. I was thinking about, because someone mentioned IRB, I was thinking about research with human subjects. Obviously, a literature review is still research, although it's not with human subjects and wouldn't have to go through an IRB. But we are really not interested in research that is going to be conducted and then be published in a journal. And that's it. Right? We're looking, again, it's the action-oriented piece, it's the actionability that is a really important part of our review criteria. So we're going to be looking for that.
Great, thank you both. So there's a pretty just straightforward question about tribal colleges not being considered community-based organizations. I think for consistency, higher institutes of higher education are not considered community-based organizations. Our intent is to focus there. And so any sort of colleges, universities for track. Again, let me just reiterate, this is the lead organization for new research support. So this CBO criteria does not apply to rapid research funds, and it only applies to the lead. So a tribal college could be a partner to a community-based organization on that application, just not the lead. I'm just going to take one more question and then have a couple more resource slides to show to you all. And this is a little bit more technical, but a couple of folks asked, could I clarify the definition of clinical research, given that much of the health equity research may fall in this category? And yes, we're aware that quite a few more clinical research grants have been rescinded. And Claire, you may want to speak more to this just in terms of what RWJF allows, but typically, as I mentioned, we have a more social science orientation of the type of work, although there's not a disciplinary preference and also a sort of an applied or implementation science preference. So we would not be funding the development of new drugs or devices or treatments for a particular disease. We generally don't fund research that is focused on a specific disease mechanism or either identification of or again, treatment for that disease. So genetic research is typically not something we would fund. Also, work that is happening solely in a lab with specimens is generally not the type of research that we're funding. Claire, do you want to say more about sort of that?
Yeah, no, I think that's exactly right, Erin. So when we say clinical, we mean those, we're really talking about technical biomedical kinds of work. We're not omitting the importance of what happens in hospital systems, in doctors' offices. And of course, that's where a lot of health inequity is kind of carried out systematically. We're really, really interested in systems change. So that's one thing to be looking for when you're thinking about your question. So we're not really thinking about individual behavior change. We're really thinking at a systems level. Sometimes that's kind of built on top of individual level decision making, but we're really thinking about systems. It's perfectly fine to submit a proposal that takes place in a healthcare setting, but it really is those kind of narrow clinical types of studies that RWJF just doesn't do. And if you want to learn more about what we've funded, you can take a look at our grants on the Evidence for Action website and kind of see what we've done in the past to give you a good sense of what works and what doesn't work as well.
Great. Thanks so much, Claire. I know there were so many questions we didn't get to. As Amani said many times, please come to one of our office hours. I'll use this just as an opportunity to say there's a whole resource center that we've developed on our webpage at evidencefораction.org /funding that provides track specific, so rapid response research awards or new research support specific Q&As, or FAQs, I should say, overview questions that are applicable to the whole CFP. This webinar will be archived on the website after we're able to get the transcript together. We're hosting weekly office hours that, again, you should sign up. You can submit questions in advance. They're technically drop-in, but we're just sort of protecting the space for you all to have those conversations. So you do need a link that you have to register for. And you can also submit questions directly through Evidence for Action email account. And I think that brings us to the end of our time. And in fact, we're a little bit over time. I will leave the last word to you, Amani, to send people in parting, and just thank you all again for joining us today. Amani.
I actually have a question, Erin, because I don't know the answer to this. So forgive me, everyone, for asking this question live. Are we archiving the Q&A so that we have the questions that were not answered?
So thank you. That's a great question. Perfect that you end that way. So we're not archiving it in a sense of publishing it verbatim somewhere where someone could access it, particularly because people's names are associated with their questions in this Q&A. But we will update the Q&A, the FAQs on our website to reflect questions that may not have previously been reflected. Many of those questions are answered in the FAQ. It's a very extensive and interactive FAQ platform on our website, but we will be updating it both with questions from this webinar, but also questions that come up during the office hours and questions that we receive through the email account that may not already be reflected on the website.
So just wanted to say thank you again, everyone, for your interest. Obviously, if you're on this call, there are many of you, and based on the questions, that have been impacted because you would be eligible for the rapid response. So we also just kind of, you know, want to affirm this kind of need to continue to support health equity research. Is such a critical time to continue to support that work. And that is our goal. Although we know we cannot meet every need, our hope is to be able to at least support and meet some level of need at this time. So thank you all so much.
Much.